So you just had periodontal surgery, and I bet you're wondering what you can and can't eat. So the goal after any periodontal surgery is to let the area heal properly. That's why it's important to follow post-operative rules, especially when it comes to eating. We're gonna go through day by day how to manage the area and what things you can and can't eat. Immediately after, you want to wait until the numbness completely wears off. A lot of times your lips and tongue may be numb and you don't want to accidentally chew on them. As for your diet on day one, after the numbing's worn off, you want to stick to cold, soft foods. Ideas are ice cream, yogurt, smoothies, and milkshakes. A nice trick I like to tell my patients is to fill up a cup with ice and water, take sips of that cold water, and just gently hold it in your mouth. This will cool your mouth from the inside out. For the 3 days after surgery, you still want to stay on a soft diet, but it doesn't necessarily have to be cold. You can start incorporating foods like applesauce, mashed potatoes, scrambled eggs, and soups. Any type of pureed soup is great. You sometimes want to keep it room temperature so it's not too boiling hot. So now let's talk about what foods we should be avoiding 3 days after our surgery. Anything that's hard, crunchy. This includes nuts, chips, pretzels. You also want to avoid foods that are sticky and can get stuck in different places in your mouth. Remember, the goal here is always to protect the area that you just had surgery on. For days 4 to 7, as the healing has progressed, you can start incorporating other types of foods. You always want to remember you still want to keep it as soft as possible. However, variety is important. Options here include soft pastas, cooked vegetables such as squash, zucchini, or potatoes. Soft fruits like bananas, avocado, or canned fruit are great. Tender meats like shredded chicken, ground beef, or ground turkey are a great add-in. Soft fish like salmon or whitefish, and pancakes, cottage cheese, or other soft cheeses. So as for what to avoid during these 4 to 7 days, you want to keep in mind we're still avoiding anything that's hard, crunchy, or sharp. This includes tough meat such as steak or beef jerky. Also, hard, crunchy vegetables are not going to be good. During weeks 1 to 4, you're going to meet with your periodontist, and depending on how your healing is going and what specific surgery you had, you're going to get more instructions from them. However, as a rule of thumb, you still want to keep away from hard, crunchy, or sharp foods in the area where the surgery was performed. Here are some helpful tips to help guide you through this healing process. Always remember to chew on the opposite side from where the surgery was performed. This will help protect the site. Using a straw is a no-no when it comes to periodontal surgery, so we recommend using a spoon when you're eating your milkshake or your smoothies. Rule of thumb, if you can smash it with a fork, you can eat it. A steamed carrot, good. A raw carrot, not so good. When in doubt, softer is always safer. But if you ever have any questions, feel free to give us a call and we'll help guide you through your dietary needs.